So according to a statement from the Health Department, it appears that the sector is scrapping contact tracing and quarantining for those who've come into contact with individuals who've tested positive for COVID-19. And this follows a recommendation by the Ministerial Advisory Committee, which suggested that the containment strategies were no longer appropriate. For more on this breaking news story, as well as the latest developments around our response to the pandemic, let's bring in Deputy Health Minister Dr. Sibongiseni, who joins us via our video link. Deputy Minister, thanks for making time. It's great to have you on the program as well. Let's begin by clarifying what the implications are of this communication around contact tracing and quarantining in South Africa. It is the third bullet point there that says all quarantine is to be stopped with immediate effect. What does that mean?
Yes, it means exactly that all quarantine will be stopped with immediate effect. It's based on the advice that we are actually picking up that the testing is now skewed towards symptomatic. That's actually what we never identified. Now, not all symptomatic people actually have been tested, and not all negative tests are true negative. So we have actually been advised that look at this time now, because of this challenge, we probably must then stop the quarantine and also stop this process.
Yeah. It's also important, Deputy Minister, of course, to make a distinction between quarantining and isolation. Those who've tested positive for the virus, according to my understanding, still need to undergo that mandatory 10 days of isolation.
We are correct that isolation rules are still applicable to both vaccinated and unvaccinated if you are actually tested positive, and we actually recommend that for 10 days, the isolation for symptoms for both vaccinated and unvaccinated if they have actually tested positive, yes.
Yeah. I haven't come across any other country taking this route, and that doesn't necessarily mean that the decision itself is wrong. It does, however, I guess, put a spotlight on how South Africa is responding to the pandemic, especially in a context where, once again, the world is watching, because this is also where the Omicron variant was first discovered.
Just like we did get an unnecessary backlash for really coming in and indicating that there's been Omicron discovered in our shores, so too we do have the best of our scientists in the world who are actually advising us. You would recall that as a ministry, we rely on the Ministerial Advisory Committee. They bring in, this is a new phenomenon in the world. Nobody is actually having a wealth of knowledge as to how they manage the pandemic 2, 3, 4 years ago. So we learn as we go along, but we are guided by scientists, and some of these are breaking very innovative findings that they advise us on, and then we take them along and we actually advise the world sometimes on it.
Yeah, absolutely. I want to just go back to the advisory itself again, Minister. We're seeing that asymptomatic individuals have a different isolation period. Theirs is reduced to about 5 to 7 days for the development of any symptoms. That too, I imagine, of course, comes from advice from scientists. But again, we're going to need to be very careful around how this is communicated to the public, lest people think that all COVID-19 protocols are being relaxed.
Yes, doctors, nurses, healthcare workers will advise those who come in and get tested in that way. Because, look, the other thing, while we are doing this, we are trying to have less and less impact on the economy of the country. You can imagine if you were to reduce if you were to keep the numbers as they are in terms of the population and those who might just be affected, and yet we still have to actually recover and actually get going with the economy. So it is also influenced by those thinking as actually advised to us.
Yeah. Another important development, especially for today, Deputy Minister, is around the official rollout of this Johnson & Johnson booster shots for the general public. Help us understand how that will work and whether you're happy with the uptake specifically for healthcare workers who've had this option for some time now.
Yeah, I understand. That one is a bit of a mathematical process. Let me just explain it to you, and maybe you'll have to help me even beyond this interview. You'd recall that from the 17th of February up to the 16th of May in our country, we started with the J&J mainly for healthcare workers. And then subsequently we had to do the police, the teachers, and SANDF. So by the 17th of May, we had finished with the category of South Africans, and then we started with the other South Africans, starting with the most affected and high-risk ones, the 60 years and above. Now, that started on the 17th of May. So anyone, or you then recall that maybe last month we started giving the booster to only our healthcare workers. Now, anyone who has received the J&J up to the 24th of October is now, today is 2 months after that. They are all of them eligible and they're due to go and get their booster. All of them. So we include our teachers, our SAPS and the SANDF, and obviously those, the elderly ones who started on the 17th of May, 18th of May, 19th of May, right up to the 24th of October, they are all of them due to go and get the booster. Maybe let me hold there for now before we go to the Pfizer, but that is how the situation is for the J&J starting for today.
That's pretty clear. So essentially, Minister, if you've received your J&J shot by the 24th of October this year, you're eligible for the booster shot as of today. And that's because the important thing to remember there is to wait for at least 2 months to pass by before getting your booster shot. So I think that's coming across loud and clear. Let's speak about those then who received their Pfizer shots. We know that it is a 2-dose vaccine, and importantly here, we're told that the time period that you have to wait is quite longer.
Yes. Okay. There's an elderly, a senior citizen, therefore, who then got the Pfizer on the 17th of May, the first dose. They had to wait for a second dose after about 42 days. So let's say they religiously went back to get their second dose on the 28th of June, the second dose. So that elderly citizen, that person in South Africa is then due to go and get the booster on the 28th of December. 28th of December, which will then be 6 months after the second dose was given. And any other person, so like myself, I got mine in July. I'm not due until the end of January to go and get my booster, because my second dose was in July. So we will start in that process, that those, the first ones who came in on the 17th of May, Pfizer, the second dose of Pfizer should have been given to them on the 28th of June. They are due to be getting their booster on the 28th of December.
Yeah. I don't mean to even further complicate the mathematics here, Deputy Minister, but what happens in a context where individuals have tested positive for COVID-19 after being fully inoculated, either with the 1 Johnson & Johnson jab or with the 2 Pfizer jabs? We know that in the past, you had to wait for 30 days before going to receive a vaccine after testing positive for COVID-19. Does that also have to be factored in for this particular booster shot?
Yeah, yes, that part has not changed. We have not been advised to change. You are fully vaccinated, but in between you get a COVID. That history, please bring that history into the vaccination sites, because that will have to be taken into consideration, and it will also be factored into the process. Let me then add on another mathematical issue which you could probably going to ask. For now, SAPRA is approved. I understand that if you were given a J&J and you go for a booster and you want to change to Pfizer, SAPRA said, yes, look, that's fine, but we as a Department of Health are taking that matter for advice to the Ministerial Advisory Committee. So for now, you will be boosted with what you got. If you had a J&J, the booster for now is going to be J&J. If you have given a Pfizer, the booster will be Pfizer. The mix and change for now, we are not advising, and we are not actually going to deal with it, at least until the meeting sits in January and advise us if that would be fine.
Oh, that's actually very important information, Minister, and I'm glad you brought it up. So to be clear, if you've received the Johnson & Johnson jab, your booster will remain Johnson & Johnson, and the same can be said for Pfizer. I'm just saying this for emphasis. That's correct, right?
Absolutely, I understand. That is what actually has going to happen now, even though there's been a talk that we could mix and change. But for now, the department has taken a stance that until that matter is processed by the Ministerial Advisory Committee, let's stick to a booster similar to what you got, and then until we get a different advice.
All right, crystal clear. Minister, thanks very much indeed for coming through to break down these developments for us. There's plenty taking place around the pandemic, and we appreciate you making time to at least help us carve out the right message at this stage of our fight against this virus. The Deputy Health Minister in South Africa is Dr. Sibongiseni Dhlomo. Once again, thanks very much indeed for your time.